Welcome to this short video on personality disorder, which is the first in the series. This is a resource for healthcare professionals. I'm Dr. Krisha Patel, and I'm the mental health lead for the company. Before we go on to understand the concept of personality disorder, we should start by answering the question, what is personality? I would like you to pause the video and write down a simple definition of personality. If you are working in small groups, then discuss this amongst yourselves. Personality traits. We all have a complete set of unique personality traits or characteristics. Some of us may be described as shy, confident, have a tendency to display emotions, happy, a glass half empty or pessimistic person, optimistic, sensitive, short-tempered. These personality traits and characteristics have developed as we've grown up, and these are what make us an individual. Although we have our own individual personality, there are some characteristics that are shared with others. We can consider personality as the innate and enduring characteristics of an individual which shape their attitudes, thoughts, feelings, and behaviours in response to situations. By our late teens or early 20s, most of us have developed our own unique personality, and we have our own ways of thinking, feeling, and behaving. Although personality traits can change, many of these personality traits and characteristics remain the same for us for the rest of our lives. What shapes our personality? I'd again like you to pause the video and think about various factors that shape how our personality develops. Write down your thoughts or discuss these amongst yourselves if you're working in small groups. Our personality is shaped by biological factors, psychological factors, and social factors. In terms of biological factors, I'm talking about inherited tendencies and genetic predispositions. In terms of psychological factors, I'm talking about past experiences, parenting styles and upbringing, experiences of neglect, physical, sexual, or emotional abuse, adverse childhood experiences, ACE, and trauma, just to name a few. And in terms of social factors, I'm talking about access to education, diversity of exposure to human interaction, socioeconomic status, experiences of poverty, etc. For most people, our personality allows us to get on reasonably well with other people. What happens when our personality traits and characteristics cause difficulties in our life and relationships with others? Now that we have an idea of what personality is and how it develops, in the next session, we're going to learn about the concept of personality disorder. Thank you for listening to this short video, and please check out the other resources on my channel.